Hello, I'm Dr. Margaret Miklic, OBGYN here at Grandview, and here today to discuss some of the most commonly asked questions with regard to the COVID vaccine in women of reproductive age. The first most common question we get relates to, is it safe to get the vaccine if I am considering getting pregnant? And the answer is yes. And in fact, we encourage patients that the most effective way to protect yourself and your baby from the COVID virus is to go ahead and get vaccinated before conception. Secondly, in women who are pregnant and are contemplating getting the vaccine, we get questions about, does it increase the risk of miscarriage? And in fact, there was recently a large study of over 35,000 women that showed there was no increase in risk of miscarriage, stillbirth, or preterm labor as compared with unvaccinated women. However, we reiterate to all pregnant women that COVID in and of itself, and particularly a severe infection, can increase the risk of all of those bad outcomes. So again, there is no increased risk of getting the vaccine when you're pregnant, and getting the vaccine goes a long way to preventing complications of severe illness. Another common question relates to the side effects of the COVID vaccine in pregnancy, and most women will experience mild symptoms such as fatigue, maybe some body aches, low-grade fever. Those can all be managed safely with Tylenol. There may be a slightly higher incidence of nausea and vomiting in pregnant women as compared to non-pregnant patients, but again, this is usually very short-lived and manageable. Women who have high-risk pregnancies often question whether or not they should avoid getting the vaccine during pregnancy because they are high risk. In reality, women who have medical comorbidities such as diabetes or asthma really should get the vaccine because they're already at a higher risk of a very severe outcome, including mechanical ventilation and, on the severe end of things, maternal death. So we encourage everyone with a high-risk pregnancy to get the vaccine during pregnancy if they're not already vaccinated at conception. As far as the increase in risk of birth defects, there's no evidence to show so far in looking at a large series of women who have gotten vaccinated in pregnancy that there's an increase in risk of birth defects. So the answer there is no. And finally, one thing we bring up is that women who are vaccinated in pregnancy tend to pass on some immunity to their infants, as many babies have been shown to carry some COVID antibodies after birth. So in summary, there are numerous good reasons to get the vaccine. All pregnant women are going to be at higher risk of getting COVID simply because of the changes in their immune system incurred by pregnancy. And the best way to prevent any kind of serious complication is to get vaccinated. And we encourage women who have any questions or major concerns to discuss this with their physicians.